Have you ever experienced any traumatic situation in your life? Do you remember any horrible incident that happened to you? Have you faced unexpected emotions and behaviors with you after any traumatic event? Trauma is a psychological term that we use to describe a very deep, distressing, and disturbing experience that happened to you in your life once or maybe many times. Like as you experience a severe accident yourself, or any death of your close or loved one. Maybe a person experienced any sexual abuse or rape. Traumatic experiences are traumatic events that are scary, dangerous, and shocking that badly affect you physically or emotionally for a long time or maybe a short time. It depends on how a person handles themselves and how severe the trauma is. If you've faced any trauma, then you'll experience some different behaviors and reactions with yourself. Let's discuss these behaviors. Number 1. Self-blame, guilt, and shame. In some conditions, when you experience trauma, you may start blaming yourself. You may start thinking and saying that the bad thing happened just because of you. It happened to your close ones. You may say that I'm the reason for this incident. Blaming yourself will lead you to self-blame even more for little things and develop depression and anxiety. Number 2. Physical reaction. When you experience trauma, you'll experience some or a lot of physical reactions and changes in yourself. It is because when you come to face with a traumatic event, it leads you towards stress, anxiety, and depression, which may cause the development of many physical reactions in yourself. Some of the most common physical reactions that you may experience are sweating on your face and hand palms. There may be severe headaches whenever you think about the traumatic event. You experience trouble sleeping and may feel as if you're too tired all the time. You feel nausea due to an upset stomach and have difficulty eating your meal. Whenever you think about that incident, your heart rate increases and your breathing rate may be high as well. Number 3. Emotional trouble. As you experience physical changes, you'll also experience different emotional responses. The emotional responses are because when you think about the past horrible incident of trauma, you may feel as if you're in the same situation and you're facing it again. In response to that feeling, you might develop some of the emotional responses. You may feel numb and don't want to be happy, or maybe you're not able to feel love or joy. You may easily get upset and angry. You may become hypervigilant. You may have an inability to experience positive emotions. You may face problems with concentration, sleep disturbance, withdrawn behavior. You may feel detached from others, and you may have difficulty trusting other people. You might even feel rejected. Number 4. Anger or aggressive behavior. One of the most common behaviors and reactions in response to trauma is anger or aggression. You show aggression in many different ways. After the traumatic incident happened, you might start thinking that the incident that happened to you is unfair. You may not be able to understand why the event happened to you and what the reasons behind the event are. These thoughts may lead you to a severe level of aggression. To express anger is healthy, but a severe level of anger and highly aggressive behavior is dangerous for you and causes problems with your family, friends, and coworkers. When you show violent behavior while you're angry, it may make the situation worse. It may lead to injury. Number 5. Alcohol and drug abuse. Here's the main issue why everyone after a traumatic and stressful situation starts alcohol or becomes a drug abuser. People start using pills and antidepressant medicines as self-medication. It's a very unhealthy way to cope with unexpected events or traumatic events. You may start using drugs or drinking alcohol in a way to make yourself numb so that you can control your distressing thoughts, memories, and feelings or emotions that are associated with the trauma. When you use alcohol or drugs, they may help you quickly toward a solution to control your thoughts and reactions, but it will lead you to more trauma and more problems. It's a vicious cycle that shows that when you use alcohol to control trauma, it'll lead you to face more traumatic situations and accidents. Number 6. Fight response. A person uses a fight response for his self-prevention. You may have no concern about who's getting hurt from your response. Sometimes a fight response is healthy and helpful, but it's also unhealthy and leads to harm to oneself and others. It's unhealthy when you're exposed to intense trauma. You always feel, or may sometimes, that you may face the trauma again, so in response to this, you may always be ready to fight with another person and become alert. You may always feel angry but without any reason. You may bully others. If you're facing unhealthy fight responses, then you must learn good behavior, or you might also have to seek professional help from a psychologist or counselor. Number 7. Flight response. When you're facing trauma and showing a fighting response, sometimes you may feel that you can't defend yourself through the fight. Then you might try to leave the whole situation completely. Flight response is one of the most important healthy ways because you'll be able to understand and sense the real danger, but it also leads to unhealthy, dangerous responses. Some of the unhealthy behavior responses that you do to avoid these situations may be obsessive or compulsive behavior. You may try to be perfect in all situations, but note one thing, that you can't be perfect in every situation. You may try to make yourself always busy. You might not be able to sit still easily in one position. It is difficult for survivors to stop thinking about the traumatic event of what happened to them. A person may experience stress reactions like fear, anxiety, stress, and he or she may try to avoid reminders related to trauma. Try to use your personal support system or try to be a supporter for those who are experiencing trauma shocks. It depends on a person's willpower how they become fine. Some cure and become normal by themselves, but some need the support of their close ones. In severe conditions, there must be a need to go to a counselor or doctor for help and treatment. Make sure to hit the like and subscribe button and leave a comment about how you feel.